This is Baldi Rai, a distant block in the district of Sultanpur, in the state of Uttar Pradesh, India. More often than not, a few dedicated individuals working together and taking small but determined steps in the right direction bring about positive changes in the world. This is a story about one such team, a team that is taking baby steps to better birth. Neonatal and maternal mortality rates in Uttar Pradesh are amongst the highest in the country, and rural health facilities contribute a lot to the numbers. Many of the rural health facilities struggle with poor infrastructure, lack of medical supplies and human resources to consistently ensure safe childbirths. Adding to the challenge, most pregnant women come into these centers at the last minute, leaving the healthcare staff with very little time to prepare or carry out all the essential practices. Baldi Rai Primary Health Center was no different until the facility staff decided to take a small step of becoming a part of the Better Birth program. A program being implemented in collaboration with the government of Uttar Pradesh.
The challenge of reducing maternal and infant mortality, especially newborn mortality, is immense in UP. Better Birth program is an ambitious program. The concept behind is simple but very effective.
Better Birth is a checklist-based quality improvement program to make childbirth safer in primary and community health facilities in the state of Uttar Pradesh.
This program focuses on adoption of essential childbirth practices with the effective use of WHO Safe Childbirth Checklist, which is a 30-item tool, along with the peer-to-peer support coaching session which are given by coaches to birth attendants.
Each item of the WHO Safe Childbirth Checklist is a critical action that is commonly missed but proven or considered by expert consensus to reduce major complications during childbirth. The 30 points are grouped together under 4 important phases during a delivery, which are on admission, before delivery, 1 hour after delivery, and at discharge.
So all the essential care which need to be provided at these junctures are listed in the checklist and which can help birth attendant follow these systematically.
Implementing the Better Birth program isn't as simple as it sounds.
जब मैं पहली बार यहाँ फैसिलिटी पे आई तो मैंने देखा कि यहाँ पे 2 ही स्टाफ नर्स काम करती हैं, 24-24 घंटे ड्यूटी करती हैं और यहाँ पे कोई एलएमओ नहीं है। सप्लाईज़ की बहुत प्रॉब्लम थी यहाँ पे। एमआईसी सर के पास भी बहुत ज़्यादा पेशेंट लोड है। तो फिर मैंने सोचा कि यहाँ पे कैसे काम करेंगे, लेकिन जब मैंने सिस्टर से बात किया, एमआईसी सर से बात किया, तो मुझे उनकी बातों से लगा कि ये लोग इस चेकलिस्ट पे इंटरेस्ट रख रहे हैं।
The enthusiastic response from the medical officer in charge early on proved to be a blessing.
जब हमने पहली बार चेकलिस्ट देखी तो हमें ये लगा कि जो हम डिलीवरीज अपने मेडिकल कॉलेज में देख के आए थे उससे जो हमारी फैसिलिटी में यहाँ पे हो रही है डिलीवरी, तो उसमें काफ़ी कुछ छूट रहा है। सोचा कि अगर अच्छे से हमने उसको लागू कर लिया तो फिर ये जो है हमारा जो कॉम्प्लिकेशन रेट है और वो सब कम हो जाएगा।
The checklist is a simple tool that depends on frontline health workers to realize its true potential. The program implementation team, through initial classroom training, and regular one-to-one coaching establish the value of the checklist among the facility staff and gain their support.
हम गाइडलाइन से उनको नॉलेज देना स्टार्ट किए तो उन्हें मतलब अच्छा लगा, मुझ पे उनको ट्रस्ट आया और फिर उसी हिसाब से वो धीरे धीरे काम कर रही हैं और आज ऐसा हो गया है कि चेकलिस्ट एक स्टाफ नर्स ही बन गई है।
The birth attendants soon noticed the benefits of using the checklist during deliveries and were inspired to start writing a new chapter in this story. The checklist in a short period of time showed improvements in making the childbirth process safer for mothers and newborns.
चेकलिस्ट से काफ़ी जानकारी मिली है, पहले से जो जानते थे उससे और आगे जानकारी मिली है।
Few of the critical practices that have brought about this change include checking blood pressure to identify cases of preeclampsia.
अब ये मालूम पड़ा कि पहले से हाथ धोने से संक्रमण के डर कम रहता है, इससे जच्चा बच्चा को मतलब कि इन्फेक्शन नहीं हो पाएगा।
Usage of injection oxytocin immediately after delivery to prevent postpartum hemorrhage.
चेकलिस्ट के हिसाब से स्किन टू स्किन कराने में फ़ायदा हुआ, ये और पहले मिल गई होती तो और अच्छे से काम और पहले हो जाता।
The team at Baldi Rai now swears by the checklist, having seen firsthand the kind of difference it can make.
The experience at Baldi Rai in district Sultanpur also shows us that once the checklist approach is accepted by these service providers, then they themselves are able to plan not only their activity but also their requirements for medicines.
On the other hand, the stock and supply of essential medicines for safe childbirth could either make or break the success of the Better Birth program.
चेकलिस्ट आने से विटामिन के, ऑक्सीटोसिन, ढेर सारी ग्लव्स, ये सब सारी दवाइयाँ सप्लाई प्रचुर मात्रा में मिलने लगी हैं कि सप्लाई तो बहुत ही सुंदर हो गया है इस समय। किसी भी प्रकार की कोई किसी चीज़ की कोई कमी नहीं है।
The Better Birth team uses heat map to track and assess improvements in behavior and practices through use of the checklist, and it has shown that there are remarkable improvements at Baldi Rai. Baldi Rai facility has since become a shining example from Sultanpur district of what a small yet inspired team armed with a tool like the Safe Childbirth Checklist can achieve.
बल्दी राय हैज़ परफॉर्म वेल, बहुत ही अच्छा किया उसने और उस चेकलिस्ट की वजह से और मोटिवेटेड टीम की वजह से जो है वहाँ की डिलीवरीज में काफ़ी व्यापक सुधार हुआ है। गुणवत्ता अच्छी आई है, कॉम्प्लिकेशन पहचाने वो समय से रिफ़र किए हैं। इसको देखते हुए हम चाहेंगे सभी CSC PSC पे इसको लागू किया जाए।
The first steps will not be easy, but with the right attitude, guidance, and use of simple tools like the WHO Safe Childbirth Checklist, a big change is possible.
The challenge lies in making the checklist work, and that depends on human behavior. So at the point of human behavior, I think our experience with this program in Baldi Rai has been very, very encouraging.
The Better Birth Checklist takes baby steps towards safer deliveries. As the sun sets in Baldi Rai, there is renewed hope that these baby steps can go a long way in improving the lives of every mother and child.
रे